Good afternoon, everyone. This is Christine Friedenreich speaking. You are listening to COVID-19, Anatomy of a Pandemic. Today's presentation is entitled Supporting Vulnerable Populations in the Fight Against COVID-19. Before we begin, I would like to do the Territorial Acknowledgement. We are very fortunate to be able to do this presentation today and recognize our Indigenous forefathers. The Anatomy of a Pandemic series that we have started came really out of the opportunity for us to showcase the work of the O'Brien Institute members and our wider University of Calgary community, and what we're doing to support authorities and governments in their response to the unprecedented scale of and human cost exacted by the COVID-19 outbreak. I'll be moderating this series. I'm your interim scientific director for the O'Brien Institute for Public Health. The recordings of this and our past webinars can be found on the O'Brien Institute website, which is o'brieniph.ucalgary.ca. I'd also like to acknowledge the COVID-19 UCalgary Task Force members who are all presented here on this slide. This task force was created out of a direct call by Mayor Nenshi to the president of the University of Calgary, Dr. Ed McCauley, asking for the University of Calgary to help in the response to COVID-19. Dr. Bill Galley is the chair of this task force, and all of these individuals have contributed. And today we're very fortunate to have Drs Katrina Milaney and Ronald D who joined our task force in the last few weeks to help provide a different perspective on some of the work that we've been doing on COVID-19. And I can say from personal perspective that it's been a real pleasure to have them join our task force, and the work that they have been doing has already informed the City of Calgary on how COVID-19 is impacting socially vulnerable populations here in the City of Calgary. And they've already written a white paper that's being used by the city in its response to this pandemic. So it's my pleasure now to be able to introduce today's speakers. Dr. Ron Kneebone is the scientific director of the School of Public Policy, and he is leading the School of Social Policy and Health Research component of that school. His recent research has focused on public policy issues as they relate to homelessness and poverty reduction. He's a member of our task force. And Dr. Katrina Milaney is an assistant professor in the Department of Community Health Sciences at the University of Calgary. She has an interdisciplinary academic background that includes sociological and gender disability theory frames, and has several years in community-based research. So today, this digital forum is being recorded, and also I want to let everybody know that you have the opportunity to actually have interactions with our speakers today. There's a Q&A box where you can ask your questions, and you can also use the comment box for those of you joining us on Facebook Live. And those comments will be transmitted to me. And we will be spending about half of this hour with presentations from our speakers. And then the rest of the time, we really welcome some questions from our audience. You can also use our Twitter handle at O'Brien COVID-19 to send us any questions. So now I'll hand it over to our speakers.
Hi, everyone. Katrina Milaney here. I'm just going to bring up our PowerPoint presentation. Thanks very much for the introduction, Christine. So you have me on video, I believe. Dr. Kneebone's video isn't activated at the moment, but he is with us. I thought we would just start with a little bit of a background, a bit of an agenda on what we thought we would cover today. Dr. Kneebone and I will go back and forth. So please keep track of your questions as we go along. There's lots of things I think that we can discuss in this area, and we're very happy to do that. So we'll talk a little bit about what vulnerability is. I think there are different understandings of it. And so just a little bit of background in terms of how we're understanding vulnerability in this particular context. Who is particularly vulnerable because of COVID-19. We're going to talk a little bit about some of the issues that we're seeing in our city both with people who are experiencing social vulnerabilities and also for some of the folks that are working frontline, particularly in healthcare and social service agencies. We're gonna, Ron has some really good examples of projects that he's working on around homelessness and emotional and financial stress. So he'll share findings from those projects. As Christine mentioned, we have written a white paper with a lot of the background information that we're going to share with you today. And we have considered or included some considerations for different levels of government. So municipal, provincial, and federal obviously have oversight over different issues and different policies and programs, funding portfolios and ministries. And so at a very high level, we've come up with some of those recommendations, and we'll share some of those with you. And a little bit about next steps in terms of how we're going to move the work forward beyond our white paper and in collaboration with the task force that Christine already mentioned, and then obviously some questions or some time for questions at the end. So vulnerability. Vulnerability, I think, is understood typically the ways in which individual people are made vulnerable or experience vulnerable or traumatic experiences. So we often think of it as, for example, limited capacity to cope with adversity. So things that happen to us, whether it's an abusive relationship, something in our childhood, homelessness, poverty, these are all experiences that impact our vulnerability as individuals. And so that's one way of understanding it. Another way of understanding it, and typically the way I sort of orient my research around vulnerability and Dr. Kneebone as well, is around structural vulnerabilities. And so these are the ways in which people experience vulnerability or have their vulnerabilities exacerbated as they're trying to navigate different systems and supports. And so I just have a little sort of description here. Vulnerability is the ways in which people are made vulnerable through our systems and our policies. And so, you know, an example would be someone who, say, enters the foster care system, doesn't have a positive experience in that system, and some of the things that they experience can actually exacerbate the trauma that may have led to their being in foster care in the first place. There's lots of information about homelessness and mental health and vulnerability, and how mental health can be a pathway in, not a cause, but a pathway or risk for homelessness, and a sort of cyclical thinking of that is the longer you experience homelessness, it actually exacerbates or can make your mental health worse. And so those are kinds of the ways in which we think about vulnerability. So who is vulnerable because of COVID? And we've sort of made a couple of distinctions here. There are folks who are medically vulnerable. So we know there are certain groups who are at higher risk of sort of the more negative impacts of COVID. Lots of people have contracted the virus and have recovered, and lots of people have not. And it's because of underlying medical conditions, some of whom are older adults. Dr. Dina Henshaw has released some information about some of the underlying conditions related to smoking and obviously respiratory illness, cancer, diabetes, hypertension. So people who have underlying health issues are particularly vulnerable because of obviously the medical issues they face. Primarily what we're going to talk about today is social vulnerability. So we've sort of defined that as people with disabilities, including mental health and addictions, residents in long-term care facilities, people in low income with limited resources and access. Some folks living in low income or living in poverty face barriers to good medical care, whether they can't afford medications or whether there are issues with transportation to get to medical appointments. So there are issues specifically around poverty and low income that make folks particularly vulnerable. Another sort of group that we're thinking about, people living in crowded or unsafe housing. We know that people experiencing domestic violence are at high risk right now. There's mixed results coming from the data. Some police data that Dr. Kneebone has access to are showing not an increase in calls to police, but our domestic violence shelters and service providers working in the sector are seeing an increase in demand. And so there's some considerations there that we'll talk about. Obviously, if someone is in quarantine or is isolating with an abuser, there are high risk factors involved there, and limited access to supports if they don't have any time away from that relationship or from that person. People experiencing homelessness, I'm sure you've noticed in the news, some cases now have emerged at the drop-in center in Alpha House Salvation Army, and so because of the limitations around social distancing, people are particularly vulnerable to spreading or contracting the virus. And this, of course, extends to frontline staff who are working there as well. And Ron's going to talk a bit more about that in a bit. And of course, any of those folks in these groups who have any of the sort of medical vulnerabilities or chronic medical conditions we've already talked about would have an increasing risk for vulnerability right now. So current issues, we have been staying fairly close to our partners in community, collecting some data from different agencies and organizations to see what's actually happening out in our social service sector. For folks who are accessing services or trying to access services and folks who are working there. So we've already talked a little bit about the domestic violence issue. We are seeing increased calls to shelter. One of the interventions that's been added particularly in the domestic violence sector, which is actually very well coordinated in Alberta. There's a great collective of agencies all across the province who work together around problem solving and sort of take a collective impact approach to dealing with social issues of the sector all the time. And they've put out some really good webinars and series on how to provide services online, doing lots of capacity building and staff training in online or virtual formats. Have also expanded text and chat capabilities for folks, like I mentioned, who may not be able to physically distance and so can't make a phone call or can't do internet searches to look for help or ask questions, can now do so through chat and text. We have been connected with the Distress Center, so you may have heard of 211 or the Distress Center, which is a 24-hour call-in for folks who are looking for supports, and they have a weekly report where they share their data with us, and they have seen 20 to 25% increases in calls about suicide in the last, since January actually, and they do these reports weekly, so that when I say 20 to 25, it varies week by week. Isolation and loneliness are amongst the top issues that folks are calling about, followed by anxiety and depression. And so these are sort of the top 3 calls, in addition to calls about suicide, that folks at the Distress Center and 211 are receiving right now. I sort of alluded to this, but there is significant stress on social agencies right now. Even prior to COVID, as you likely know, either significant cuts or threats to cuts to social service agencies and their funding, primarily at the provincial level. And so a lot of agencies were already feeling the pinch and feeling the strain and the stress around uncertainty about the future of their services, the sustainability of their organizations, whether they were going to have to lay off staff, cancel programs. And so COVID really has exacerbated some of those issues that were already starting to bubble up. And some of the agencies that we've talked to are worried about the financial strain at a time when demand is increasing. One of the things we think about a lot in this work is how long the increased demand will last beyond sort of isolation and the closing of services from times in Calgary when we had the flood, and from sort of economic downturns. We know that these things can last a long time beyond the actual crisis. And so agencies are worried about how they're going to manage that if there are limitations in their budgets. And of course, this is a primary concern of mine actually, is the stress and burnout on frontline staff. A number of staff in homeless shelters have worked every day since mid-March, long days in really stressful situations. And so having to deal with issues that they don't necessarily feel trained to do, and having to do that at a time when they are worried about their own health and safety seems to be exacerbating things. A couple of other issues that are bubbling in the sector and the community right now are around substance use. Substance use typically does go up during a crisis. Historically, we've seen this. We are starting to see increases in this as well. Overdoses have increased in shelters, according to staff who work there. And there is concern about access to harm reduction supplies. So folks are worried that supply will be limited and they won't be able to continue to offer clean supplies. And so there is concern about harm reduction interventions and potentially an increase in sharing of supplies, reusing of supplies because of either fear or real limited access to those kinds of options. And as we've already sort of talked about, there are now cases of COVID in our homeless shelters. And so that is obviously an area of concern. I'm going to turn it over to Dr. Kneebone. He has some results for some research that he's been working on and is going to share that with you now. So over to you, Ron. Unless there's something else you want to add, of course.
No, that's great. I mean, thanks for that great introduction, by the way, and great summary of the issues. That's really, really good. A couple of things I would just emphasize on the points that you raised is that so many people that we identify as being vulnerable have health issues, all of which are going to be exacerbated by the effects of a pandemic, whether it impacts your social isolation or your stress levels, which I'll talk about in just a moment. It all makes your health worse. Health that was not good to begin with, making it worse. And that's going to take time to recover from this. So even when the pandemic is over, hopefully that comes soon, the impacts of the pandemic are going to be long-lived. I also just want to emphasize the point you made, Katrina, which is we rely, I don't think people often understand how much we rely on social agencies to provide social services. Many people will think it's the government that does these things, but it's really not the government that does everything. Many of these, many shelters, whether it's domestic violence shelters or homeless shelters, many other services are provided by social agencies who rely partly on government funding, but also on the generosity of the rest of us. And they are under an enormous amount of pressure, not only financial, but also, as Katrina emphasizes, the stress on frontline workers. First, I should also apologize. I'm sorry, my camera's not working. It made the fact that I shaved this morning all go to waste, so that was too bad. But maybe that's for the best anyways. So I just want to talk briefly about the effect of the pandemic on people experiencing homelessness. And I'm going to start by emphasizing something that not everyone's always aware of. A homeless shelter is not like a hotel or something where people go in and they can stay. What actually happens with a homeless shelter is that, excuse me, people come and go. And we have an idea of how many people come and go. So we have people moving from the community into a shelter, and then they move from the shelter back in the community. Some of them stay in one shelter, say the drop-in shelter, one night, but they might stay in the mustard seed another night. And as you can see from that kind of movement, there's a real potential during the pandemic to move the virus from the community into the shelter, and once it's in a shelter, to move into other shelters. So how big a risk is this? Well, one of the ways of getting a handle on it is to understand that we classify people experiencing homelessness in different categories: transitional, episodic, and chronic, depending on the length of time and the number of times they stay in a shelter over a certain length of time. So someone who is a transitional user of shelters, as you can see from the graphic there, they stay in the shelter for very short periods of time, maybe 2 or 3 days, and they only do that 2 or 3 times over a year or 2 years. They are the most frequently, that's the most frequent example. 86% of people experiencing homelessness in Calgary are behaving that way. They go into shelters for 2 or 3 days, and they do that 2 or 3 times over a 2-year period. Then there are other people who have, only 12% of those experiencing homelessness, they have more episodes, but they're also short stays. And we call those episodic stayers. And finally, there are those we would call chronic users of shelters. They're people who stay in a shelter for a long period of time. They only do it once or twice over a 2-year period because they're there almost all the time. And it's important to emphasize they're only about 2% of the total. So the stereotype that a lot of people have about homelessness, that somebody who is a long-term stayer in a shelter, they're relatively few and far between. Most people using shelters stay there for just a few days, and then they leave and they come back sometime later. And of course, that's important to emphasize because those are the guys who are moving in and out of shelters and between shelters as well. The red numbers in the graph, the red percentages, are the percentages of shelter beds used by these different groups. Now, the chronic guys, of course, they're in the shelter a long time, and so they fill up a third of the beds. Transitional guys move in and out, but they're different people all the time, and they fill another third of the beds, and same with the episodic. So what I want to emphasize here is that there's a lot of movement in and out of shelters, into the community, back into shelters, and between shelters. Now, exactly how big are those flows? That's a really good question, and we're starting to investigate that right now. It's a more complicated question than you might think to answer because you have to track individuals as they move around. My best guess, and it's just a guess at this point, is that there's about a 15 to 20% turnover in a shelter every night. That's a lot. So I'm going to guess that about 150 people a night are staying in a shelter who weren't there the night before. So as you can see, there's a real potential for spreading a virus. I am absolutely amazed at the numbers that Katrina cited, that there have been so few people identified as carrying the COVID virus in homeless shelters. And this is a real credit to the efforts that have been made to get people who have been identified as carrying the virus, isolating them and keeping them away from others. Still, I am amazed that there hasn't been a further spread of the pandemic. And I do live in fear that that will eventually happen. If we go to the next slide. And I take a drink of water, try and clear my throat. Nope, back. Here are two sets of results that are worth emphasizing. The one on the left is something we released just yesterday, and that uses data provided to me by the Calgary Counseling Center. And what they do is they collect, when you go to the Calgary Counseling Center and ask for help, they do a stress score on you. And their goal is to, over time, as they give you more counseling sessions, see that score fall over time. And they're doing this to try to measure how effectively they are helping you. What they did is they provided me with data from 2008 to 2019 on the average first session stress score. So in other words, how stressed were people when they came for help? And to give you some, and on the vertical axis, you see those stress scores. Just to give you some context there, somewhere a little bit below 70 is a stress level that we all live under stress, and that would be kind of a typical level of stress that we all live under. Once you get above 70, then you're starting to feel the stress is starting to impact your life and is going to be in a negative way. Once you get up to 80, then you are extremely stressed, and there should be real concerns about your health and the need to get that stress down. And what I did with that data is I graphed that data against the employment rate along the horizontal axis. And that's a measure of the state of the economy. As the employment rate goes up, it means more and more people have jobs. As the employment rate goes down, people are losing their jobs. And as you can see in the graph, there's a very close relationship that as the employment rate falls, which is a measure of the economy turning downward, people's stress levels go up. And in 2019, the stress level, almost at 80, was at a historic high that the people at CCC say they've never seen before. And it was a real concern that stress in Calgary was that high. Now, what's the source of the stress? Of course, this was the downturn in the economy. This is all pre-COVID. So you can now imagine what the COVID virus is doing to people's stress level. Not only have more people lost their jobs, so we're moving further to the left in that graph and upward, but we're also having a new source of stress. Am I going to get sick? Are my loved ones going to get sick? What's the implication of this? Again, as I said before, we can expect long-term health costs to be paid. A lot of people are going to take a long time to recover, even when the COVID virus hopefully ends. The graph on the right is similar, except now I'm not looking at stress, but what stress often turns into, which is suicide. And there's two graphs, there's two sets of data there, one for Alberta in red and one for Canada in blue. I'll just focus on Alberta. And what that relationship shows is as the unemployment rate goes up, I should have used the same employment rate, so this is a bit confusing. But now I'm looking at the unemployment rate, and as I move to the right here, the economy is getting worse. And what we see there is that as the unemployment rate goes up, the economy gets worse, suicide rates tend to rise. This is another consequence in that graph, simply of a turn down in the economy. Now, if we layer on top of that, what would be the impact of the COVID virus on this? You can probably guess it's not going to be good, and that probably those numbers may be going up. And so what I just wanted to stress here is that when what do we expect this COVID crisis to do? One of the things it's going to do is not only add to our financial stress, but also to our emotional stress. And those things can have dramatic effects on the healthcare system in the future, and of course on our daily lives. If you feel these effects yourselves, imagine how this is impacting someone who is already under a lot of stress because of their living with poverty, they're living with a disability, or some other ways that are making them part of our class of people we call vulnerable populations. Katrina.
Thanks very much, Ron. So now that you're all depressed and sad, this is sort of a curse that I face all the time in my work. We often have to talk about really heavy topics, and it's difficult to do that. But I think, if we can think about now, what should we do? How can we respond to this? Then it sort of gives us a bit of a sense of hope. And so one of the things, and I'll just ask Ron to jump in whenever, because these were developed collaboratively. We have sort of created some considerations for the City of Calgary based on things that are within their jurisdiction, and the province and the federal government, and sharing all of this information with the city, recognizing that they also have conversations with folks in the province. Decisions that are made at the provincial level obviously have impact on our city. So providing them with this information as well, so that in their conversations, they can, sort of think about these considerations and the implications of them. And so some of the things that we've come up with specifically for the city are around additional resources for police and social service agencies. So, we've already talked about long-term impacts, and we're not sure of the impact on crime rates. We do know that there are some differences in street drugs and how they manifest. There's I guess, you know, to just be blunt, there are bad batches out right now that are really affecting people in very negative ways, and really changing the way overdose actually manifests. And so we don't know what the long-term impacts of that will be, but it is conceivable that there could be stress and strain on Calgary Police. Also around domestic violence, if increased calls start to come in. And so just because things are opening up and people are getting back to work and going about their lives, doesn't mean that the issues won't persist for a while. So we're recommending 3 months after stabilization that additional resources be made available. We know that there are temporary facilities available in our city for homeless shelters right now, the TELUS Convention Center. You know, the opening up, as you've probably heard, will happen in different phases, and certain things will open up first, and then second, and then third, depending on the implications of each of those phases. And so our thinking is, you know, if limiting social gatherings between 50 and 250 is going to be in phase 3, then you might as well leave the TELUS Convention Center open, because it, you know, it can't be used for other things. And like Ron already mentioned, we don't know if we will see an outbreak in homeless shelters moving forward. And so keeping those temporary facilities open to the very last phases, we think would be very important. Ron, did you want to add something?
I would just emphasize that I think the steps we've taken to increase social distancing within homeless shelters by opening up the TELUS Convention Center, for example, these are sorts of things we should stop doing last. In other words, we've got to keep this going for well past, well into this crisis. It would be a real mistake, I think, to start moving back to business as usual in homeless shelters. We've got to maintain that distancing. One other thing, I'm not sure if you're going to mention, Katrina, but some of what we're seeing too is that there's an increased number of rough sleepers. Mm-hmm. These are people who are experiencing homelessness and are choosing to sleep outside at night rather than use the shelters themselves. And of course, one of the reasons for doing that is because they're trying to avoid the virus. One of the things we want to do is emphasize to Calgary Police and by law is to go easy on their enforcement of the rules with respect to rough sleeping camps, because, I mean, for obvious reasons, these guys are trying to escape the virus. Mm-hmm. And so these are things we need to also pay attention to.
Yeah, absolutely. And shelters do have areas in their shelters right now for people who need to self-isolate. And so obviously keeping those spaces open will be really important too. And just to build on Ron's comments around rough sleepers, one of the initiatives that's underway right now is to try and get sort of hand sanitizing stations more available in public spaces, including C-train stations. So that would obviously give people who are outside an opportunity to practice hygiene in ways that they haven't been able to before. One of the things that's really important, I think, we know that there are a lot of Indigenous people in our city who are experiencing homelessness or who are in these sort of socially vulnerable groups. And there are a number of collaboratives and initiatives within our city that work very closely with elders and knowledge keepers, recognizing that spiritual healing and emotional healing, cultural healing is a key aspect of many people's lives. And so being cognizant of the fact that full partnership and full consultation with those groups will be really important in terms of how do we ensure that people continue to have access to services that are culturally safe and access to conversations with their spiritual leaders through this time. So that's another consideration or recommendation that we have provided. And obviously long term, I think in the bigger picture, one of the things that maybe a silver lining outcome from all of this is that it will be really hard to argue that social vulnerabilities like homelessness, substance use, mental health are not public health issues. They very much are public health issues, and we're seeing that very clearly right now. And so the absolute best intervention for all kinds of people who experience social vulnerability is access to affordable housing. When people are in housing, their own housing, they are safer at least. And that is our long-term recommendation. It always has to be a part of the conversation, despite the fact that we are in crisis right now. That doesn't change. So a couple more considerations for the provincial and federal governments that we are thinking about. So as you know, there has been some emergency financial benefits that have made available for folks financially impacted by COVID who may not have access to things like employment insurance. Our recommendation would be to extend those emergency benefits beyond stabilization or beyond return to work. If someone does go back to work but they've been accessing the benefits, they may also have been deferring their utilities payments, potentially rent and mortgage payments. And so having access to those benefits beyond going back to work will help people deal with some of that debt that may have accumulated. We also know that in the panic of this, people may have used credit or debt or gone into debt to buy food, emergency supplies. And so we are concerned about a new level of vulnerability. So folks who may have been managing okay, but who may be at financial risk now. So is there a way to think about extending those benefits a little bit longer so folks don't find themselves in long-term financial vulnerability? We are suggesting that no changes be made to harm reduction services, that any of the recommendations that came out of the provincial report around supervised consumption services prior to COVID not be implemented in 2020. We don't know the long-term impact, like I said, and like Ron has talked about as well. And so it is our recommendation to just sort of stay the course with the supervised consumption clinics, make sure people have continued access to safe supplies beyond, like I said, stabilization. This is a recommendation that Ron came up with, which I think is absolutely brilliant. We have a number of people who are dependent on financial benefits because of disability who cannot work. And so those benefit levels are below the CERB benefits that are available to working folks. So could we think about extending access to those CERB benefits to folks who are on government financial assistance, including seniors, for example? We've already talked about safe supplies and naloxone, making sure that those are readily available beyond supervised consumption clinics, but within harm reduction organizations that play a role in this part of the sector. And one of our biggest recommendations is around, before you start to cancel agency supports, financial supports to folks, do a reevaluation of the demand on services. So some of that data that we saw from Calgary Counseling Center and the Distress Center in 211, making sure that those numbers are stabilizing or going down before we actually start to cancel support, emergency support for social service agencies and for Albertans. Ron, did you want to add anything around considerations before we move on to what we're doing next?
No, I think I'm anxious to get to questions and debate.
Okay, great. So we'll just wrap things up to say that beyond these recommendations and considerations that are being forwarded to different levels of government, we are looking for some research funding to look at the implications of the pandemic, specifically in emergency shelters. We did do a study after H1N1 when there was a big outbreak in our shelters here, and we made some recommendations then. So pulling on that thread to see if any of those interventions were implemented and folks were, if that's part of the reason why there hasn't been an outbreak, and what we can learn now that we've had this second pandemic in our shelters. Obviously, continuing to support the University of Calgary's COVID response team with data surveillance, with looking at interventions, the impact of those interventions, and then looking long-term at how we can assess the implications and the recommendations that we have made and any changes to policy and service delivery that might come from that. So, Ron?
Yeah, I'll just one comment about research. As it happens, we had started at the School of Public Policy a research issue looking at the role of social agencies in providing services to vulnerable populations. The urgency of that research has just gone up because of the pandemic, and not to mention the downturn in the economy. So that's something we're looking at too. The financial resiliency of social agencies should be a really important goal for government. There is a Premier's Council has been set up to look at that issue. I'm hoping that we can influence their thinking on that and make them understand the really important role the social agencies play.
Excellent point. Thanks. Okay, I think it's time for us to turn things back over to Christine for questions.
Thanks very much. My video can get started again here. We'll just open that up. So thank you very much. I think that was an excellent presentation, and we've got lots of questions that have come in from our audience. So the first question was, how are you providing this information to Dr. Hinshaw and her office? And how are we optimizing on the power that she holds?
Well, actually, I'll try to answer that, but Christine, this might be a good question for you, actually. It just as part of the university COVID response team that Dr. Galley is chairing, several meetings with folks in Alberta Health and with the City of Calgary, including with the mayor, and just being a part of those conversations, we shared our backgrounder, and we did a version of this presentation to them as well. Did you want to add anything, Christine?
Yeah, no, I think there is actually interest in the white paper, and one of the other questions we have is regarding the white paper and whether that is something that can be shared.
I do think eventually it will be, for sure. It is a bit of a work in progress because we're trying to be responsive as these issues emerge and shift and change. And so, you know, we will be strategizing ways to make it available publicly in the near future, for sure.
For sure. Okay. So the next question we have is regarding food insecurity, and wondering whether we've considered any of the issues around food insecurity, particularly regarding children, since they're quite vulnerable, with classes paused and some nutrition supports that are provided have ceased for those. And so just wondering about how the supply chain is another consideration pertaining to food insecurity. So I don't know if you want to, if you're able to answer that.
I will do my best. It's a really good question. Food bank usage is up, and some of the calls that are coming into the distress center that we didn't share are, the primary concerns around how do I access food safely. And the question about children is really important. The other group, of course, is seniors, many of whom are afraid to go out and go to the grocery store. And so it's hard to answer that question in a systematic way, because aside from the food bank, there are a number of community organizations that also offer hampers and access to food for their clients. And so what I would say is the strain is there, the issue is real, and I think it's happening in ways that are sort of disparate depending on the different agencies. But I do think that there has been a great mobilization around that. But the issue is that people do have to be connected to some kind of service agency to access those services. And so it's a good question and definitely something to keep an eye on.
Yeah, I'll just add, that is a really good question. And the pressure on the food bank has been very significant. The other thing to keep in mind is a lot of families with low incomes don't have the same, they don't have the same opportunity to social distance as maybe a university professor has. And that's why it was always most important in my mind that income support should get to people dealing with low income first and foremost, and people on social assistance in particular, that in order for them to do what has been recommended to all of us, which is to social distance and minimize the number of times you go to grocery stores, etc., they don't have the same savings that someone like me would have to be able to do that sort of thing. They needed that support. I continue to think it's really important that the government think about providing more income support to people on social assistance in order to enable them to avoid the food insecurity, which is threatening them, especially those who have lost their jobs as a result of this, and to help them carry through the pandemic.
Excellent. Yeah, so the next question, this might also be something for Ron, and I know we've had these conversations with the City of Calgary as well. The questions surrounding the eviction policies for people who are the sleepers that you mentioned before, wondering whether the city has changed its eviction policies for these individuals, given that transmission is likely lower outdoors, which we already talked about, and certainly lower than in the crowded shelters. And I believe that the mayor said yes, that they were being more lenient, but maybe you could just expand on that a bit, Ron.
Well, actually, Katrina might know better than me about the role of double evictions, et cetera. I have not heard any policy other than the Premier asking landlords to behave themselves, but I haven't heard anything more formal than that. And we did hear from the mayor that the bylaw was going to go easy on their enforcement of rough sleepers. Katrina, do you know anything more than that?
Not much more than that. I think there has been a shift actually in this city over the last few years around leniency anyway, generally speaking, and bylaw officers often go, when they come across these camps, they will call other services like Calgary's DOPE team. If you're not familiar with them, they're a street outreach team out of Alpha House who go in and just see if they can offer services and supports and refer people to services and housing programs actually. And so there's been a great partnership between city bylaw and some of those street outreach teams to try not to take enforcement as the first step. And so, yeah, when we did have a conversation with the mayor last week, he said we're already lenient and we continue to be lenient in this situation. So
this is a bit of a follow-up question on that. Linda McFarlane has said she's seen some Facebook posts from a small grassroots group that supports the rough sleepers by providing some food and care packages. And she wasn't sure about how great the need is, but wondering how, if there could be more coordinated approach to responding to that.
I wonder if you're talking about Be the Change YYC, grassroots organization. If you are, then I could say that they are in desperate need of PPE and supplies. They do go out and engage people who are outside and provide you know, basic needs type stuff. So food, water bottles, you know, clothing, whatever they can get. And they are completely volunteer basis. And so if you see them on Facebook, I would reach out for sure. They are a group that, you know, these are folks that work all day and then at night they go out as volunteers and try to do their part. So in terms of a coordinated approach, Alberta Health Services has street outreach teams. The DOPE team through Alpha House has a street outreach team, and they do coordinate with each other and they do work together. But you could contact any of those organizations if you had an interest in supporting them or finding out more about what's going on.
It's worth mentioning as well, Katrina, that when someone is a rough sleeper, increasingly they're doing that in order to avoid the shelter during a pandemic. They go back to the shelter for meals and even for sanitation facilities. And so this sort of services minimizes their need, the rough sleepers' need to go back into the shelter and risk exposure. So it's a really good program.
Okay, so and Robert Wiles is wondering also, there's a lot of interest in the rough sleeping approach that we and they're wondering if you have any thoughts about whether there should be a formal or endorsed encampment location. Some jurisdictions have been considered to consolidate and provide services both social and health more effectively. So would that be a good idea for us here in Calgary?
Well,
Hi, Robert.
well, you know, I have wondered about. Everybody remembers the Great Flood when Calgary got flooded, and how quickly a big area full of ATCO trailers was set up to house people on an emergency basis. I don't think we need to rely on people sleeping in tents hidden away in city parks. We could actually formalize it and say, this is an emergency, this is a pandemic. Let's do as we did during the flood and set up this encampments in the form of ATCO trailers and make sure people are safe and secure.
Okay, thank you. So the next question is regarding the CRB benefits to those on AISH and who are unemployed. I'm just wondering whether the government of Alberta is allowing recipients to keep a portion of those payments. Apparently it's the first $230, then 25%, or are you asking for a more generous clawback rate? So this might be an question for Ron.
Yeah, so what I'm suggesting, the issue is that people receiving social assistance, in particular people on AISH, often earn income, and they have an earned income exemption, after which your benefits are taxed back for every dollar you earn beyond that exemption. So the issue here is that during the pandemic, many AISH recipients who were working are no longer able to work. And so should they receive the CERB benefits? Well, the answer is yes, but the problem is the legislation as it's written, legislation which was written before anyone ever dreamed of a pandemic coming along, would actually tax back the CERB benefits dollar for dollar. And so what some governments are doing, and I anticipate Alberta doing this as well, is allowing AISH recipients and Alberta Works Assistance recipients to keep more of the CERB benefits than they would under the current legislation. So I'm sure there's a big panicking going on in the government as they try to rewrite legislation to account for something they didn't anticipate coming. But that's one thing they should do.
Okay. The next question is probably another Ron question. It's, is basic income an approach that should be considered during this recovery?
Sorry, I missed part of that question.
Is a basic income, if that's an approach that we should consider during the recovery?
Well, we should have another webinar for 3 or 4 hours and talk about that issue.
That's fair enough. Fair enough. I mean, it is a big question for sure.
I think it's my preference is to really think hard about the thing to enable what is the most important thing of all, which is housing. And Katrina talked about that earlier. The thing that the pandemic is asking us all to do is stay isolated. But if you don't have a house, if you don't have a home rather, then you cannot stay isolated. And I think what the pandemic really is doing is making it crystal clear to everyone that we've got to do something about the problem of affordable housing, and we cannot continue to warehouse people in homeless shelters. We've got to do something about this, and this is a golden opportunity.
Mm-hmm. Okay. And we've got one question I'm just going to take from our Facebook viewers. So Karen Thomas is asking, what changes made during COVID would you like to see retained going forward? Katrina can handle that one.
One of the thoughts that I have is from some of the folks working in emergency shelter and other social agencies who've actually been able to access emergency financial supports, and they've been able to enhance service delivery. And so, for example, in one of our homeless shelters, they've actually added LPNs. They've had doctors able to come on site more often, access to mental health supports. I think, and you know, if you ask them, and they are the experts, not me, but if you ask them, they say, we can't go back. We can't go back to the way we were operating before in a full-on crisis response all the time without being able to add medical supports and healthcare supports for people in shelter. And so one of the recommendations coming from our sector is that, you know, the enhanced services that we're able to offer right now, it would be amazing to continue to offer those beyond COVID.
Okay, good. Next question is from Bonnie Larson. What are we expecting in terms of an increase in homelessness throughout and beyond the crisis?
Well, I'm going to guess a movement up in the homeless count. Although I'm an economist, I'm doing the one hand too. On one hand, on the other hand. So on the one hand, there's certainly people who have lost jobs, have lost their source of employment, and they're going to find it hard to maintain their housing. On the other hand, the government, I applaud them for doing this, have made available income support through the CERB to help people with low income maintain their housing. On one of my other hands, I'm talking about people who are couch surfers, who rely on friends and family to look after them. Maybe that's going to be more difficult during a pandemic, and so they're going to have to rely on a shelter instead. So I really don't know. I'm curious to hear what Katrina thinks, but I'm not sure what will happen to this shelter population.
Yeah, I think there are a lot of variables that we don't really understand fully yet, but one of the things that's happening in the family sector and the family shelters is that one of the shelters in particular has moved to a rapid response housing approach. And so moving families, using these emergency benefits to move families very quickly out of shelter into their own permanent housing. And I think that's an amazing outcome. I think the long-term impact is unknown at this point. Will those families be able to sustain that housing once the emergency benefits run out? That's what we're not sure about. And so we could actually see an increase in family homelessness in particular, even a month, 2, 3 months down the road.
Great points.
So Nishan Sharma, our colleague, is asking, Ron, you said you were amazed that we haven't seen an outbreak in Calgary with the estimated 50% turnover in the shelters. So do you or Katrina have any idea why this might be? Do you think it's other measures? Is it luck? I know it's probably speculation, but.
Well, I think we have to give credit to the response of the shelter system to increase social distancing by opening up the telecenter. And as Katrina mentioned, when people are diagnosed as carrying the virus, they are quickly separated from everyone else. That has been a great response, and I'm really impressed at how well that seems to be working. I do fear, however, as we start to relax, that it may not be over.
Yeah, absolutely. We've got lots of questions coming in, so I'm just going to keep doing it for another couple of minutes. So what are your recommendations about how to respond to COVID positive people who are experiencing homelessness, who are not choosing to or unable for other reasons to self-isolate within available resources?
We had this conversation with some folks from the city actually, and we have 2 options. We could bring in enforcement. We could have bylaw officers and police patrolling and ticketing people who are out in public spaces who are not going to shelter. Or we could do things like adding sanitation outside in C-train stations. And, everybody, I think, has an opinion on what is the best way. My opinion, this is just my opinion, is enforcement is not the way to go. I think we are talking about people who don't live the way that we live. They don't have options or opportunities the way that we do. Like Ron mentioned, they can't self-isolate in their home, and they are living in spaces with hundreds of other people. And so to force them to be in a situation where there are hundreds of people around them, where they can't actually physically distance from others, I don't think is the way to go. And so for me, it's about leniency. It's about building supports out in community, giving access to hygiene. We have street outreach teams that we've already talked about that can hand out hand sanitizer, that can try and support people to refer them to housing programs, things like that. So that's my sort of thinking on it. Enforcement for me is not the way to go.
Excellent. Our next question is regarding the impact of stress and burnout for frontline workers. When you're considering that, have we considered home-based caregivers and parents of adults and seniors with complex needs, and whether that's been included as a topic of research?
It's a very, very important point. We hearing a lot from the disability sector that, we have a lot of family caregivers that are looking after their family members with complex health issues and with disabilities. And the reason they're doing that is because they don't have access to the community supports that they need. And so they're already under stress and strain to provide care for folks, maybe not able to work, generally speaking, not outside of a pandemic, because they are caring for loved ones. And yeah, it's a really important issue. And I think one of the sectors that is the first to get cut when government budgets are examined is the disability sector. And so when we make public policy decisions and funding decisions based on different populations and what we think is important and what we think people need, we inevitably put other people at risk. And so I am very concerned about what is happening with folks who are stuck at home without access to supports and trying to support complex health issues and disabilities. And so it is definitely an area of concern for research. And, we did mention we have a project that we're trying to get funding for right now, which is looking specifically around the impact on people who are working in these kinds of situations. So it's a big issue and a good question.
So I'm going to have to wrap up this session. We still have a number of questions that haven't been answered. So we will take these questions that haven't been answered yet We'll give them to our speakers, and we'll try to get responses out to the individuals who have contacted us. I just want to take this opportunity to thank both of our speakers for a very interesting, stimulating, excellent presentation, lots of issues raised, and obviously lots of things that we discuss. And I thank all of our participants as well for being so engaged and answering so many, asking so many good questions that we could answer. So thank you very much, and goodbye.